Hello and welcome back to Trade Talks. I'm Leanne Alfaro, producer and host here at Nasdaq. Joining me today is Bob Garrett, CEO of Hackensack Meridian Health. Thank you so much for joining us.
Thanks for having me, Leanne.
And you're here today with some healthcare updates from Davos, so
Yes.
very eager to hear. First of all, tell us about your experience there.
It was a great experience. I've been going to Davos, to the World Economic Forum now for 3 years, and I have to say that each year has gotten better and better. And why this year was, I think, very special is there are just more healthcare talk there. The healthcare community has grown. There's probably about 70 or 80 companies now that represent healthcare that are there. There were a lot of bilateral meetings where you can really develop future partnerships. So I thought the experience was really good, very, very structured, very intense. 3 days, you go from like 6:30 in the morning until like 9 p.m. So they were long days, but they were worthwhile, and I thought I got a lot more out of it this year than ever before.
Now, you delivered a talk at Davos as well about healthcare.
I did.
Could you tell us a little bit more about it?
I did. So I was a conversation starter discussion about emerging technologies in healthcare and how they're going to play a role in really transforming how healthcare is delivered in the future. So what I spoke about is, first of all, I spoke about data and access to data that we have like we've never had before, and how that's really that with the exchange of that data, we're able to really share best practices and improve healthcare outcomes. I also spoke a lot about telehealth and telemedicine as emerging technologies, and they're really making a huge difference. As an example, in the U.S., Kaiser out on the West Coast, about half of all of their patient provider interactions now are through telehealth and telemedicine. And then another example, in China, there's a large healthcare app that is being used widely by 230 million Chinese citizens, and many of them are receiving their health information and their health care from that app, and that app is actually going to be expanding into the Southeast Asia area. So telehealth and telemedicine, there's no doubt, whether it's an emerging country or a developed country like the United States, is going to be a big factor in providing healthcare in the future. I think that in the past, the center of the universe for healthcare was the hospital, and in the future, it's going to be our smartphone, no doubt about it. So we'll be delivering healthcare without an address.
I mean, that's certainly a lot more convenient as well.
It is. It's much more convenient. So, as an example, in behavioral health, there are many patients that have behavioral health disorders. We don't have enough psychiatrists, and people sometimes have to travel long distances to receive that kind of care. With telepsychiatry or telehealth, they'll be able to receive consultations from psychiatrists and specialists much more easily. Another technology that I spoke about is artificial intelligence, because literally that's becoming a lifesaver in healthcare. Through predictive analytics, we're able to now really predict when a heart attack could happen and prevent it, when a stroke could happen and prevent it, when coronary heart failure becomes more acute. And even in terms of detecting breast cancer early on, artificial intelligence is playing a significant role. So to me, that's really a big game changer in healthcare, because through that predictive analytics, we really can save lives.
Yeah, absolutely. I mean, I think that artificial intelligence is going to be a game changer, as you said, in the big scope, especially for serious diseases where everything is not as predictable or as formulaic.
Correct. And we're using it in cancer, diabetes, heart disease, a lot of the chronic diseases. And that was the other theme in Davos this year. In the past years, they've really talked about communicable diseases and making sure that vaccines are available in developing countries. This year, there was a little more focus on chronic diseases, on non-communicable diseases, because as those countries are developing, they're seeing big increases in chronic diseases, again, like diabetes and heart disease.
Wow. Now let's talk a little bit more about the disruption to the health industry that not only telehealth is posing, but just in general new and emerging technologies. You mentioned something interesting, which is that these emerging technologies are not only playing an important role in developed countries, but also emerging countries. Could you talk to us a little bit about how this applies to all countries overall? It's not something that only the U.S., for example, will be able to benefit, but also other countries?
Yeah, so back to telehealth as a disruptor, there's no doubt that that will play a big role in all countries because, as healthcare providers are in short supply, whether that's in the United States, and we see that with primary care physician, with psychiatrists, we're seeing that, all over the world. And one of the things that the health ministers shared with us in Davos was, people might not have ready access to a doctor or a nurse or a physician extender, but one thing that they do have is the smartphone. And that really is a total disruptor, and it's a great thing because people really can receive health care, and not only just health care, but health information, and ways to prevent disease from happening through really the smartphone technology.
And how accessible it is by people from everywhere and of all socioeconomic levels.
Everywhere.
It's
everywhere. It's a phenomenal, and it's kind of, you have to start wondering about that, right? People are really, they have food insecurities. They may not be able to know exactly where the next meal comes, but they have access to a smartphone, and that will really help us so much in extending vital health care to these remote regions.
Absolutely, a powerful tool. So talk to us, how is Davos an incubator then for this kind of disruption?
Well, because Davos really, there's so much opportunity for partnerships, for technology companies to really partner with providers and with insurers to really develop new models. So one example is we announced in Davos this year that we're forming a global coalition for value in healthcare. And what we're doing is we're actually bringing together those various sectors, the technology sector, as well as the provider sector and the insurance sector to really provide value. And value, what that really means basically is a focus on healthcare outcomes. So we need to work in private and government partnerships to really transform reimbursement so that there really is an alignment of incentives and that everybody really benefits from focusing in on value and on outcomes as opposed to just volume of patients. So it really does become an incubator because it really is an opportunity to put these various forces together that normally wouldn't be talking to each other. So we have these bilateral meetings, and you have meetings with technology companies, with insurance companies. I was talking to CEOs of technology companies, of insurance companies each day that I was out there.
Yeah, no, I mean, that's fantastic to be able to bring all these thought leaders and all this innovation all in one place.
All in one place together, and it becomes that incubator, and just that coalition on value in healthcare. What a great initiative for us to all get behind.
Well, hopefully you and I both can be out there next year talking about this, talking about emerging technologies and how it's disrupting healthcare.
I hope so. And maybe the skiing will be good too.
Absolutely. Thank you so much, Bob. Really appreciate you joining us.
Thanks, Leanne, for having me.
Trade Talks followers, thank you for joining us on another episode. That was Bob Garrett, CEO at Hackensack Meridian.